Today we will discuss about temporal bone. This is left-sided temporal bone. Why this is left-sided temporal bone? Because the petrous part lies medially and squamous part this is lies upward. So if we bring this in anatomical position, this indicates this is a left-sided temporal bone. Now the parts of temporal bone. This is squamous part of temporal bone and this is petromastoid part. It is called petrous part and it is mastoid part, and it is the styloid part of the temporal bone and it is the tympanic part of temporal bone. Now the squamous part of the temporal bone, it has two surfaces, external surface, this is called external surface, this is internal surface, this is called superior surface, and this is antero inferior surface, and in its external surface it gives attachment to the temporalis muscle and a vertical groove present in the external surface which is for middle temporal artery, which is the branch of superficial temporal artery, and in its internal surface there are some impressions. Here you can see the impressions which is for the sulcus and gyrus of the temporal lobe. Now the mastoid part, this is the mastoid part, it has two surfaces, external surface and this is internal surface, and two borders, this is called the superior border and this is the inferior border, and in its external surface it gives attachment to the sternocleidomastoid, splenius capitis and longissimus capitis, and here presents a mastoid foramen. The structure passes through this foramen are the emissary vein and meningeal branch of occipital artery. In its internal surface a groove is present, a curved groove. Here lodges the sigmoid sinus. In it now the superior border articulates with posterior 1/3 of lower border of the parietal bone. So parietal bones attached with mastoid part of the temporal bone and its posterior border articulates with the squamous part of the occipital bone and its mastoid process, this is called the mastoid process. It's absent in the newborn and it first appears in the second year due to the action of sternocleidomastoid, and here is the mastoid notch, you can see this, it is called the mastoid notch, and here the posterior belly of digastric muscle attached, which developed from second pharyngeal arch. Now the tympanic part, this is called the tympanic part and this is the mandibular fossa. It has two parts, anterior articular part and posterior non-articular part. Anterior articular part articulate with the mandible and posterior non-articular part here presents the parotid gland. Now the petrous part of the temporal bone, this is the petrous part of the temporal bone. It has apex and base and this is called the anterior border and this is called the superior border and this is the posterior border, and surfaces are anterior surface, this is posterior surface and this is called the inferior surface. In its apex here is an opening called carotid canal and internal carotid artery enters in through this canal, and base merges with the squamous part of the temporal bone. In its posterior surface here is the internal acoustic meatus and structure transmitted through this through this meatus are called facial nerve and vestibulocochlear nerve and labyrinthine artery. And in its inferior surface it is the lower opening of the carotid canal, and it transmit internal carotid artery. And here is the jugular fossa, and the content is internal jugular vein. This is called the styloid process, and the attachment of styloid process are three muscles and two ligaments. Three muscles are styloglossus, stylopharyngeus and stylohyoid muscle, and two ligaments are stylohyoid ligament and the stylomandibular ligament. And this is a foramen which is called the stylomastoid foramen. This is called stylomastoid foramen because of its presence between the styloid process and the mastoid process, and the structure which exists through this foramen is called facial nerve, and the stylomastoid branch of posterior auricular artery which enter through this foramen. So thank you all for watching this video, and like this video and subscribe my channel.